and I had a job that was
This meeting is being recorded.
it was kind of administrative. I was the medical director of a weight loss center for a while, and I took all my steps. It was like a crazy deal. I took all my steps in 2020, and finally I got to apply to residency, but I also got very lucky and got a license in Georgia, so I practiced as an attending for occupational medicine before residency. And after that, the crazy match happened. And you probably already know, if you're here, that once you're an immigrant, like to come from another country to train somewhere else, it's a little difficult to get into residency, especially in situations like mine when you've been a doctor for a while. And so I have a very, very difficult match. Montefiore was my only interview. I only interviewed place, and that's who signed me in. But because of that, if you probably already know, PM&R is an advanced track for 2/3 of the spots. So you have to match also me, and I had to after the soap, not even in the soap I got positions, so had to like network and try to find a spot. Finally got my spot. I did my intern year in Puerto Rico. Um, and so it worked out. I'm here, it pays off, but it's been difficult. So it's very important as an IMG to learn what the system entails, what you have to do to apply, what are the things you could do to improve your resume. And so since my match was so difficult, since then I coach a few IMGs a year. I coach an average between 5 and 6 people a year, and fortunately some of them have success, some of them have like harder journeys, but I coach on how to have a successful CV, which is very important, and like convey all that information the way it wants to be conveyed for the program directors to understand your prior experiences. Second of all, a good personal statement. I coach on like reading people's personal statement, give them my opinion. I have like a very structured way to work on it. Always are useful, but my way to structure it is just to have an important message for you to deliver to those program directors. And then we work on interview skills, things that they should know to your prior experience, how to say and talk about your prior experience that looks like a strength instead of like gap or those kind of stuff. So it's important to know a little bit about that. So that's kind of who I am, what I've done. Finishing PM&R, applying for fellowship fairly soon. Very exciting. PM&R is the best field ever. If you're here, you know what you're doing. This is the best. And that's it. Hit it with the questions, Jordan. Go.
Sure. So one of them I think is like kind of very broad and I think important is just how to stand out as an IMG applicant in PM&R.
Very relevant. Again, we just said a little bit about that. Being an IMG in this cycle, it's very difficult and it's getting more difficult. But to stand out, you should show passion. I want to say, in advice, personal advice that I give to my mentees is be raw. I want to see why you want this. And people who know me, like Jordan, know that I'm like all the time sweating PM&R, that I love what I do. And you need to show me that. You need to progression. You need to show people why is this. Is it related to your story? Is it related to something that happened? Is it related to how you discover medicine? Is it related to something you really find out that you didn't know? A lot of the people maybe outside states don't have a lot of exposure to this specialty, unfortunately, and sometimes just stump into it and you really find this gorgeous field. Do you understand what we do as a specialty? And also, are you willing to do all the hard work if you haven't gone through the whole process to learn from our specialty? So that's really, really important. And so that's, I think, the way to stand out. Little simple tricks that I give to a lot of IMGs that probably some of them don't know is in the United States, there's a lot of societies that are related to our specialty. So become a member of those societies. Try to attend the conferences if you can, but like pay for membership and showing your CV that you have a linkage to our specialty. That's really important. And I'm um, a lot of people, there are some people that on art sometimes don't want to apply as second choices or other choices to a specialty. And so showing commitment to the specialty is really a hook to know that you're going to be a good physiatrist. So having experiences within what you've done, is it research, is it conferences, is it posters, they have to be related to our field for me to know, for the program director to know that you want this specialty.
So another question, somewhat related, is how do you find IMG friendly PM&R programs, as well as both for residency and then as well as doing like rotations or any away rotations in the US?
Difficult, a little difficult. A good thing that I used when I was applying was a website called a Resident. Some of those, and you have to pay for in Residency Explorer can give you an amount of IMGs in a program and an amount of programs that have a different balance of composition. This can be also relevant for DO applicants, and sometimes the DOs want to apply to programs that are welcome to DOs. But for IMGs, it's allowed to like flag these people. As an example, there's 500 positions for PM&R, and when I match, only 10 matches were from IMGs. So this is a small specialty still, and there's not a lot of us. So it's easy to find us. You know, we're in social media. PM&R posts pictures of us saying, "Hey, you matched, congratulations!" And so reach out. Like you cannot imagine people have reached out to me, and I've talked to my program director to offer for rotations, and they've gotten them. You don't know how much people are an example of the things that you want to be. And so I think it's important to be bold and, hey, I am this and this, I am doing this, and I love this field, and tell me why. This is just not like, hey, I kind of think I love why. But if it's in my power, I'll help you. I can assure you a lot of the IMGs in this field will do that for you as well. And so those connections can lead you to having rotations, to having opportunities, to teach you which ones are. But if you want to be a little bit more broad, more global, these instruments like Match Resident, like Frida, like Residency Explorer, give you percentages of us in these programs, and the certainty or the percentages of people matching, which can be helpful to make this decision.
So there's a question in the chat, and I think we also had somebody submit a question very similar, but how would you suggest to address any gaps or interruptions in your education?
Very important and very common for IMGs. The gaps there are red flags for the programs are mostly within your training. Things that have happened before medical school are not so important, or like you don't need to be fresh out of high school to know that you were going to be a physician and then suddenly getting into it. That's not usually how it goes, and program directors understand that. Also, program directors appreciate variety of ages and experiences. So be proud of what you've done, and especially if what you've done has some relationship with our specialty, or you can kind of like make it look like that. I don't know. In my program is very, very IMG friendly, and there's a lot of people that have gone through it, and a lot of people, meaning people that have done other specialties before, people who had other careers, like people who were orthotists or like PTs before, and then decided to do med school and then physiatry, right? So there's a lot. So before med school, just make sure to be proud of what you've done, to show it, especially if it has a link to our specialty. Enhance those experiences. Show that what you've done has a relationship to your field. After starting med school, those gaps can become a little bit more worrisome, because when the program director is trying to recruit, they are thinking, is this person going to pass the boards at the end of the specialty? Those are the measures that they're used. So, knowing that you have passed your scores, your boards, and those kind of stuff is helpful for them. But if you had anything that interrupted your education, just be honest into saying why and what was the gains of that gap, right? Uh, as a physician for 4.5 years in Colombia, and I decided to move to the US, and there was a small gap between my practice as a full-on physician in Colombia to becoming a physician in the United States. But that practice gave me a lot of perspective into business, into what is to be in the US, into what is practice in the US, into the introduction to culture in the US. And I greatly appreciated that experience for myself, and I put it in my CV. It was clear everything that I did in that meantime, and also how it helped me grow. Address it in your personal statement. Be bold. I failed my step, and I learned how much I need to be better at studying, and why was this important as growth. I had to take a year off because I had a family problem, and it made me grow and understand how it is to be a patient on the other side. Those kind of things are really important, and you want honesty, and you want, it's what I always said, raw, like that raw perspective. I want to see you. I want to hear from a human being, because in our field, being human is very important.
So this is not actually a question anyone submitted, but I'm just wondering, it might be helpful. Do you see kind of the difficulties that you faced when applying for the residency match? Does that kind of follow you through with fellowships as well? I know obviously you haven't gone through it yet, but have you seen that from other people?
Not really, not really. Fellowship is a much different perspective, in which there's a lot of spots that don't get filled. There is a lot of opportunities to work as a physiatrist without having to do fellowship. So I don't think that would be the case. Maybe for more competitive fellowships, a little bit sports medicine, a little bit of pain medicine. But as long as while you're in residency, do what you have to do, express your interest, make the right connections, I don't think that's going to be an issue. I think it's going to be mostly at that stage of residency application.
And then, why is California not IMG friendly? How can I beat those odds and match out west?
Very difficult question. I really like California, and I even did I had a small experience in California before matching, and I thought it would be a good place. I thought it would be friendly. I thought, I speak Spanish. They have a lot of Spanish speakers. It would be good. California is a very saturated market for physicians, and that makes it hard. And there's a lot of med school, and there are very good med schools. So they tend to stay local and pick their own, the people that train themselves. That doesn't mean there's not space for IMGs, but it's just difficult. What I think the way is it to open doors. My year was the first year that everything went virtual. So something really cool that happened is that AAP opened this pre-match, pre-interview season, where all the programs would give us some little lectures in Zoom calls like this, and everybody would get to know each other. So this way, I met a lot of people in the field that I wouldn't had the chance to meet, including people from the West Coast. And I met from people in Stanford. What I want to do, for example, is very, very unique. I'm a trained opera singer, so I want to pursue performing arts medicine. And so there's only less than 30, 40 physicians in the United States that do that, mostly physiatrists. And so I was like looking actively for those people. And I think the West has some of them. And I actively reached out, and they are very receptive, and they will listen to you, but you have to demonstrate some competitiveness, and that's difficult. That's difficult, and I would say if you are planning this from school much before applying, make sure your scores are very strong. Unfortunately, that's a thing. That was not my case. My scores were terrible, but that can move you forward. And so if you make those connections pretty early, they'll know, they'll hear from you, they will look to your strengths, and they'll give you people. Just you have to make yourself present with them, either in projects, either in connections, either in posters, either in conferences. You need to make sure that they know you, and it takes a little bit of time, especially with those people, to make the connection.
Awesome. So we actually have a lot of questions, well, a couple questions about letters of rec. I guess kind of the main thing is just if PM&R is not necessarily a rotation in med school, how do you go about getting letters, especially when, you have to get letters early on and you might not be able to do these electives or these aways until closer to your 4th year?
Very good question. I don't feel like you have to rush to do this very early. Now being in this side and seeing how the experience for MSTREs is in the US, and even people like who come to the US to have those rotations, don't rush to get a letter, months in advance, or do a rotation that's very in advance. It's even better to do it around the time of the match. This month, right now I've had 8 medical students in my rotation. I'm running the floor right now. And I think it's going to be better to have that late exposure. But again, for IMGs, since we don't have those connections, it's all about networking in opportunities like this, reaching out to the right people, trying to assist to those kind of events. Like, again, the conference, I know I'm sounding a little repetitive, but it's the only way you're going to knock on the door and say, hey, like, I don't know much about this field. I don't have a lot of opportunities, but I'm trying to look for it. And try to like really tailor that to programs that will accept you, that will, be willing to take IMGs. There's programs that are famous for doing that, like mine, or, Minnesota, Berk. They have taken IMGs before. John Hopkins lately, big surprises. So you have to make sure that you express that interest and make those connections early, so that when the time comes, you can establish that. A little difficult, but not impossible.
And along those same lines, how do you recommend getting away rotation, since most of the international schools are not part of the VSLO? Is it just kind of about this question? Is it just about making connections, reaching out to residency coordinators, directors, and hoping for the best? Or is there any specific tips you have to maximize your chances?
It's difficult, or more difficult, in academic institutions if the IMG programs don't have connections within the system. But that doesn't take away. I would say even a letter in a private practice in someone that opens the door for you to do an observership can be useful if you show interest, if you are proactive. I and I want to say it from my experience, it might be more difficult nowadays that the field is becoming a little bit more competitive. But I had letters from U.S. doctors that were not in PM&R, but the PM&R letters that I have came from my country. In my country, I had PM&R exposure, and the program director from the PEDS rehab in my country gave me my letter of recommendation, and that really worked out for me because her letter was absolutely honest and beautiful, saying it is. I think the quality of the letter really you can be starting up physiatrist that writes a letter for a student that maybe you're trying to give it an opportunity. You don't have to be this fancy program director of the chair of the chair of the chair. Um, but if your letter is really portrays who you are as a physician and who you can be as a resident, shows your resilience, shows your human skills, shows the experiences that count towards patients. You don't need to have a letter or a personal statement or a CV that tells me all these pain procedures that you've seen, but I really want to see a human being in that letter, someone that's kind and understanding and listens to the patients, because in our field that's even more important than putting a needle in the spinal canal. And so it's very important that your letters, if you want them to stand out, convey experiences that are really important to this field in that human aspect of care, even if they come from the most fancy important person at Harvard or the small private practice physiatrist that's opened the door for you to have exposure to this field and wants to talk good about you. Um, be honest and direct to your letters. Tell them. If you sometimes, and I see this all the time, uh, we have a rotation with someone's very important in the New York PM&R Society, Dr. Stern, and everybody wants a letter from her because they say they go a long way, but her letters are very genetic. They'll say something really nice, but they're gonna be like pretty bland unless you really strike her eye being a kind and caring physician. And then is when she's going to write a medium letter. But if you go to a private practice, to someone that you contacted, someone that's opening the door, and they see your kindness and they see your humanity and they see how much you care and how much you want this, they will write a more impactful letter. And I think that happened to me. My letters talked about how I was as a physician, and they were from great friends in my life, the rheumatologists and PM&R doctors back in my country. And I think my letters had a better impact because they had something better to say about me and they were not from a very renowned physician or physiatrist in the US. So I think it's more about the quality of the letter that way. And you, as a letter requester, can tell, Dr. Fuentes, write me a letter with experience that I had about wonderful SCI patient that really touched me as a physician, made me understand what the reality of this disability is, and made me want to do this even more. It will include a real experience about a patient that programs director will see much more.
So the last question we have is not necessarily IMG specific, but I also am interested in this because it's interesting to hear you talk about it. But any recommendations on where to look for programs with opportunities in performing arts medicine? This is by one of our.
Thank you, Kate, for the question. So interesting. This is a wonderful field of physiatry, very rare. I would recommend to join Performing Arts Medical Association, PAMA. I'm going to type it here. I'm probably going to send the link in a minute in the chat. We are a very small society of physicians, not only physiatrists, but all kinds, and not only physicians, but all healthcare professionals that take care of artists. Our meeting is once a year. It was in July in New York, and next year is in London. So but more than that, we have young professional meetings every month. We try to mentor and peer with people that have this interest. For example, I'm a trained opera singer, so they try to match me with someone that does some voice. And so there's a lot of people in the field that do dance medicine, like what she's asking, and they get peer with professionals in this field, either physiatrists or sports medicine physicians, the most that do dance. There's a lot of us that have those interests, and so I would say that's a great resource. Um, Another way that it can be getting involved is just going to a local art center, like getting in touch with that community around you that do performing arts, that have dancers, that have singers, that have musicians, and volunteer. Try to get exposure yourself from that field and learn from them. One of the things that artists appreciate the most is having that closeness. Like, you as a provider understand what being an artist entails, and that's one of the things that they look the most. They want comprehensive care. They want understanding care. They just don't want a doctor that's going to offer something that's completely irrational to their practices and their customs. So it's important to feel artists when you are caring for artists, and so not only reach out to the community of in science that takes care of them, but also getting involved with the arts, seeing what it's an artist, or what it takes to be an artist, and go see art, go see an opera, go see a musical, go see an orchestra. That also makes you understand how much effort it takes to be an artist, and how much specific care is best when it's done at the highly professional levels.
And I believe last question we have, which is actually a great question to end on, is how do people sign up to have you as their mentor?
Reach out to me through Instagram. I am also in Twitter. Um, just talk to me. I sometimes I'm busy, but if I will respond to all my messages. I'm pretty OCD about that. So if you have passion for this field and you are a little not oriented, I generally take most IMGs. I am nothing against US students or DOs, but of course IMGs, we need more help, we need more love. So, but if you ever need me to read your statement or anything, with my little experience on this field, but reach out to me through social media. I guess you guys can share my social media, and we can definitely do what is best. Nowadays that I have had a few mentors and they have gone into see if I don't have the time to take care of you, if there's any conflict of interest, I will assign you a mentor as well.
Can we share your email on here as well?
Yes.
I think that is it. Thank you so much.
Oh, you guys are so welcome. I love this kind of initiatives. I think it's super important to open spaces, to talk about this, to share your struggles, to be inspired. Um, and one thing that I always taught every one of my mentees is like pay it forward. Once you've gone through, once you've done this, once you've learned what it takes, once you've gone through the horrible match, because it's awful, be prepared. Celebrate, and then for someone who's looking for help, teach them. If you don't know, if you don't have the resources, communicate with people that have helped you before, and pass that mentoring, because we need that in our community, and especially in this field. We're friendly, we're nice, we want to help you, and so don't be afraid to reach out.
Awesome. Well, thank you again. And bye, everyone.
Have a good night. Thank you so much.
Thank you so much. That was awesome.